Additional technologies to detect antigen-antibody reactions. Column agglutination, or gel testing. Column agglutination, commonly referred to as gel testing, is a modern serological technique used to detect antigen-antibody reactions with enhanced precision and clarity. This method is performed in a specialized chamber where centrifugation is carefully controlled to facilitate the testing process. At the heart of this technique is the gel matrix, which functions as a filter. When a sample is centrifuged, unagglutinated red blood cells are small enough to pass through the gel and settle at the bottom of the column, indicating a negative reaction. In contrast, agglutinated cells, which are clumped together due to antigen-antibody binding, are too large to pass through the gel. These cells either remain at the top or are partially suspended within the gel, depending on the size of the agglutinates. This pattern signifies a positive reaction. This method is also used for phenotyping red blood cells. When reagent antisera, such as anti-A, anti-B, or anti-D, is embedded in the gel, red cells that carry the corresponding antigen will agglutinate upon contact with the antibody during centrifugation. In indirect antiglobulin testing, IAT, a mixture of antiserum, serum, or plasma and red blood cells is placed in the upper chamber of the gel column. If the red cells are sensitized, i.e. coated with antibodies, they will be agglutinated by anti-GG present in the gel and will not pass through the matrix. For direct antiglobulin testing, DAT, using gel technology, washing steps are not required. Only unsensitized red blood cells will pass through the gel, while sensitized cells will agglutinate when they encounter anti-IgG in the gel, remaining suspended or trapped within the column. Solid phase technique. This technique utilizes a microwell plate as the testing platform. In this method, either an antibody or an antigen is immobilized on the surface of the microwell. In the first variation, antibodies are fixed to the sides of the microwell plate. When red blood cells that express the corresponding antigen are added, the antigens bind to the antibodies lining the well. In the second variation, antigens are adhered to the microwell surface. Then, plasma containing the specific antibody is introduced. The antibody binds to the antigen on the plate. After a washing step to remove unbound components, cheek cells are added, which attach to the bound antibodies, completing the reaction. The results are interpreted visually. A positive reaction is indicated when cells are seen adhering to the sides of the microwell plate, confirming that antigen-antibody binding has occurred. Conversely, a negative reaction is observed when a pellet of red blood cells settles at the bottom of the well, indicating that no binding took place. Pretransfusion testing. Pretransfusion testing is a critical component of safe blood transfusion practices. It begins with the sample accompanying the transfusion request. The recipient's serum or plasma must be clearly labeled with 2 unique identifiers. Additionally, there must be a system in place to document the identity of the phlebotomist and the date of collection. After transfusion, both the sample and a segment of the transfused red blood cell unit must be retained for 7 days. For patients who have received allogeneic red blood cells, are currently pregnant, or have an unknown transfusion history, a new sample must be drawn within 3 days of the transfusion. The day of draw is considered day 0 in this timeline. The testing process includes several key components. A BO grouping and RHD typing are performed. Notably, weak D testing is not required for patients. An antibody screen is conducted to detect unexpected antibodies. A crossmatch is performed, although an autocontrol is not required. It is essential to compare current results with prior testing. This includes reviewing the patient's ABO group, RHD type, any previous difficulties in blood typing, a list of clinically significant antibodies, and any history of transfusion reactions. Special transfusion requirements should also be noted. The crossmatch procedure involves mixing the patient's serum or plasma with donor red blood cells. The mixture is observed for agglutination or hemolysis, which would indicate incompatibility. If the current antibody screen is positive, or if the patient has a history of clinically significant antibodies, the crossmatch must be carried through to 37 degrees Celsius incubation with anti-human globulin AHG. If the antibody screen is negative and there is no prior antibody history, an immediate spin or electronic crossmatch may be used. For patients with clinically significant antibodies, antigen typing is performed to identify compatible donor units. In cases where prophylactic antigen-negative units are needed, calculations are used to estimate how many units must be screened. Finally, quality control, QC procedures must be carried out on the day of use. This includes using a positive control, such as a heterozygous cell, to ensure the accuracy and reliability of the testing process. This also includes using negative control, such as cells without antigen,